I remember my first job was in Broomfield Hospital as an orthopedic SHO. On my first day, one of the nurses asked me my name, and I responded by saying my name is Dr. Rizwan Qureshi. She looked confused and perplexed with a rather long name of mine and asked if there is a shorter version for this name. And now I was confused how to shorten my name. My colleague who was sitting beside me, and he was a local doctor, he said, "Hi Tracy, my name is Matt." What a lesson I learned that day. The first few months were very overwhelming for me, with the daily ward rounds, hundreds of jobs from those ward rounds, visiting emergency departments for acute presentations, and also trying to assist in operation theatre and clinic. I also sensed a huge cultural shock from both patients and my colleagues. I thought medicine was all about providing care, and it is a universal language. But of course, there's much more to it. Hello and welcome. I'm so glad to see so many messages from doctors who share their hardships and journeys, and finally the good news of getting their first job here in Australia and other Western countries. Indeed, it's a lot of hard work to achieve where you've come, so congratulations. The real work, however, starts now. So let me share some of the lessons that I have learned by both being a junior doctor myself and then as a consultant for the last 7 years, mentoring registrars, residents and interns about their performances, especially during their first jobs and especially for IMGs. I'm going to divide this conversation into what to expect in your first week, adjusting into your new work and dealing with your colleagues, improving your performance and efficiency at work, and passing your term. Before even your first day, you buy yourself a nice comfortable shoes and well-fitting scrubs. Most hospitals now have all their staff wearing scrubs. There are different colors for different grades of seniority. So find out what color code your hospital follows. In the hospital that I work, it's black for consultant, green for registrar, blue for resident and interns. Now you must obtain your security pass. This will grant you access and entry into the hospital, the wards, the tutorial rooms, the toilets, everywhere. You're pretty much blind without it. Also, please do your computer or electronic medical record or EMR training. You must have your username and password ready and functioning before the first day of your job. You would be expected to write notes, request blood tests, radiology, and all the other things through the hospital computer system. If you drive to work, make sure that you've seen the hospital car park area and you have obtained your parking access. Some of the hospitals which are in the city, the parking can be an absolute nightmare in the street, and it's actually not safe, especially if you're finishing up late on your evening shift. So it's always better to use the hospital car park. The first week, overwhelming, different accents, how to even write notes, history, take bloods, and where is everything stocked? These are the very basic things that you often feel very confused and very overwhelmed about. If you did not do any courses, orientation or observership, this could be a very hard time for you, like everyone else. If you are prepared by spending some time as an observation at the same job or at the same hospital, that will really help you prepare. Visit the hospital and try remember the location of the wards and major areas of interest like radiology, labs, tutorial rooms, staff room, toilets, and various other landmarks in the hospital. Most hospitals can be very overwhelming and confusing through corridors and stairs and lifts, so make sure that you are well aware of all these things. The other thing is that most hospitals will offer free one-day orientation to fresh doctors. You must attend that. If you've been offered a job, you can even ask for an informal observation on the ward. That will act two purposes. One, it will orient you to the hospital and the surroundings and how the work is done, and will also help you to obtain a handover from the leaving team to the joining team, which you are a part of now. Be punctual. In fact, arrive 15 minutes early every day. This will give you ample time to have your list of patients printed for the ward round and also do some quick planning for the rest of your day. Now, introduce yourself to the team of consultant and nurses before the ward round, and please mention it to them that you need or you may need some extra help because this is your first job. It's never too late to ask for some help. Now you will realize it's a big team. Try to understand the roles for everyone. There will be consultant, there will be registrar, there will be resident and interns in a medical team, and there will also be medical student. Nursing team will have a nursing unit manager, registered nurse, which are pretty much like residents, also AINs or assistant nurses. There'll also be orderlies and cleaners during the ward work. You'll notice them, so please don't confuse them as a nursing staff. Also, there'll be clerical staff and they'll have a completely different uniform. There'll be also members of allied health team like physio, OT, speech, social workers. So make sure that you understand the various roles and what are they expected to do, and never shy from asking that what is your name and what is your role. Asking for help is actually much better tolerated than making a mistake. Now, the other thing I'd like to say, if you don't understand anything during a ward round, your consultant is speaking, he's just carrying on in his own rhythm of doing things, ask for help. Ask for clarification. Ask them to demonstrate to you how various things are done, especially during the ward round when everything is moving at such a fast pace. Now, introduce yourself to the nurses after the ward round. Like, I'm Sadia, I'm one of the new residents on a gastro team. I'm Rizwan, I'm one of the new registrars on aged care team. And also plan a little informal meeting them for a cup of tea when they're on their break, just to break the ice and say that, look, I'm a new resident and what is an expectation from a junior doctor? Also try learn the skills which are repeatedly done in the hospital or during your ward work, like cannulation, bloods, tubes, catheter. These are pretty much the day-to-day routine work for most GMOs. Also, you'll be doing a lot of documentation. So develop a template of your own documentation. That might often be based on something like a SOAP assessment, like subjective object assessment planning. And it's very unlikely that the condition of the patient will change hugely during the daily ward round, but you might be able to tweak your notes every day to be more efficient in your documentation without missing anything major. A professional medical documentation course that we offer can be easily accessed to our website emergencyfocus.net/courses. It's 100% online and will orient you how to different forms of documentation. Now, the other thing is, it may appear that your colleagues are good at doing various tasks. They're far more efficient, but don't compare your first week to them being in the system for years. Experience everything. See as many patients when you're working, especially in emergency department. And try also to do help with the things that you're good at. You might be good at cannulation. You might be good at taking notes because you're a fast typer. One thing I cannot emphasize enough, because there's a lot happening in the ward and during the ward round or even in an emergency, prioritize your tasks. Think what needs to be done first and what can wait, or better, if it can be delegated to some other member of the team. Teamwork makes the dream work. Most doctors in team like to communicate through text. So join your work text group through your mobile. It might be a Bleep, which is an official app that we use here in New South Wales Health, or it might be an unofficial WhatsApp group. But just be careful of not sharing any confidential details, X-ray or blood results on those platforms. Now, the other thing that doctors love to do is do coffee rounds in the morning. So join for a coffee break with your consultant, with your registrar. This is one of those things which breaks the ice. Even sometimes buying a coffee, because these are the colleagues you'd be working with for a long time. Also, try not to miss important days at all, like post-call duty days, operation theatre days, clinics, teaching days. And if you can volunteer to present a case on one of those teaching days, that's the best opportunity for you. Everyone loves a doctor who can confidently put up a very nice, short and punchy presentation. It does not really matter how interesting, rare or complicated the case is. It's all about creating a discussion platform. Plus, it also helps you stand out from the crowd and makes it easier for you to obtain a good reference from your consultant who would remember you from the presentation. But it's very difficult to, judge you during the daily ins and outs of the ward rounds. So that's a no-brainer. Now, improving your performance and efficiency. As much as you should start on time, it's also about finishing on time. Have your next day planned, or pre-planned rather, in a matter of prioritization, put in the blood forms, the radiology requests for the CT scans and X-ray. So all of these things are done before you start the next day. Update your list for the next day rounds, leaving some space for the new patients, because your team might be post-call and there might be new patients admitted under your care, and you can just add them by hand. Now arrive 15 minutes early, as I said, and add all the new patients and their location. In these most Western hospitals, the patients are scattered throughout the hospital. They might be in ICU or isolation ward or MAU or gastro ward or somewhere or the other. Now during the ward round, you will see and you will use computer on wheels, something called COW. As I said before, use your templates to document history. They're efficient, they save you time, and you can use them repeatedly for different patients. And there are various shortcuts available which hospital computer staff can show you how to use them. If you're working in emergency department, the working culture is somewhat different. It's all about efficiency. You must try to see as many patients as you can. Now, there's no hard and fast rule, because some of the patients can be very simple, some can be very complicated, but it is expected a resident to see at least 8 and 9 patients. And to be honest, it is not that complicated. Your job is to go and take a history, examine the patient, and sit down with your consultant planning the investigation and management. So it is a very thorough assessment and management, and teaches you a lot in a very short span of time. Initially, you might be slow, but with the same practice repeated over and over again, within 2 to 3 weeks, you will be flying very efficiently. It does not take much to learn about the complexity and to assess the patient, because all the emergency department are very well supervised. Also in ED, be mindful, your consultants might be very busy. So stack up your patients. Have 2 or 3 patients discussed in the same go, so that you've got plans for most of them, but don't sit idle. Now, lastly, passing your term. Passing term means that throughout your term, you'll be assessed. You'll be assessed for your various skills, with your medical knowledge, with your communication. Now, passing term is also an important milestone that forms a part of your eligibility towards general or full registration. Your term is assessed by a supervisor who will ensure that you've completed all the requirements in an efficient manner, and you can communicate clearly, and as I said, you have proved yourself to be a very safe doctor. Now, it is your responsibility. If it's your first term, ask for an informal feedback. Sit down with your supervisor and say, just over the 5 minutes, can you just give me a few pointers as to how you performed and how can I improve? So the way it goes by is that all consultants and registrars sometimes would sit down together, and they will go through a template worksheet in which there will be tick boxes done for your performances in various areas, and then you'll be either given a pass or not pass. It's very unlikely that you will fail a term if you're a safe doctor, but if it does happen, you may be asked to repeat a term. Lastly, I would just touch on some do's and don'ts. Do's: be always punctual. Number 2, be courteous and smile. If there's any confrontation, resolve it, and always try to have a learning point for the future. Now talk to everyone in your team and ward. There's no time to be an introvert. This is in fact a very point to be an extrovert. The failure to communicate can be taken very harshly by some people. So try talk to people, make friends at work, and it will improve your performance. Now also be willing to offer for help. The things that you're good at, only do help if you can. Don't overwhelm yourself. Now participate in teaching, especially if you're meant to be presenting, do present. And also never miss an opportunity to informally teach medical students. That can go directly into your CV. Have coffee breaks, have lunch breaks. These are crucial fuels to have a 10-hour shift or 8-hour shift, whatever it might be, go like a breeze. Now the don'ts. Never call in sick unless you are genuinely unwell, and always show up at work. Don't say yes to everything, especially if your work schedule is very busy. You must never compromise on your own well-being and your patient's safety. Don't ever argue with nurses or any medical colleague, junior or senior. If there's any confrontation, make a note of that, document that, and discuss it with your supervisor to find a best way of dealing with this matter in the future. Don't ever accept a rude or bullying behavior from anyone. If someone does not sound right, misbehaving with you, make a note of that and escalate and discuss with HR or medical staffing. Don't stay late at work and bring your frustrations of work back at home. When you're at home, you must switch off and recharge. Finally, enjoy your time, spending your time in a more efficient and productive way. You have come very, very far. And from your humble beginnings, you are very lucky to be working in a very well-paid, very good, healthy environment. So use this as an important milestone to diversify your learning experience. Also improve your professionalism. This will also teach you several skills in dealing with people, communicating with various people from different cultures. So use that to improve yourself. All the best and best of luck for your future. Thank you.